Good morning, everybody. We've got a wonderful packed schedule, so we're going to start right now at 11:30. We've got a good group, and I assume that we'll get more rolling in as we work through the agenda today. But to start, I just want to say welcome, and we're so grateful for your energy and commitment to policy that improves health for everyone in Colorado. My name is Allie Howe. I'm fortunate to serve as the Public Health Senior Policy Director for Colorado Public Health Association. And our first order of business is to give a big thank you to the Colorado School of Public Health and also Frontline Public Affairs to help us in their support for this event. And we are going to do 3 poll questions while we're waiting for the last of our colleagues to join us. So you'll see 3 questions appear for the poll, and we've got 1 minute to complete these poll questions. I'm kind of hoping that we vote for Come Together by the Beatles, but we'll see what song that you guys picked. All right, let's wrap up that poll and let's see the results. I love it. We've got a few friends joining from the road, so thank you for our road attendees, and be safe on the road while you listen to our policy information. And my dreams came true. We did pick Come Together by the Beatles. So we'll make sure to pass this along to our representative guests today that this might be an easy resolution to pass, to pick a formal song for this session. And I was also hoping that we would also have a majority choose this last one for question number 3. So I think that's definitely the common thread that brings us here together today to see how policy can impact not just us professionally, but the lives of those we love. So thanks for sharing that poll with us. And next, I'm pleased to introduce our Public Health Associate Director, Ellen Stern. She'll provide some housekeeping information and kick us officially off for our first ever CPHA Public Health Town Hall. Thank you, Ellen.
Good afternoon, everyone. I am Ellen Stern, and I'm happy to be serving as the facilitator this morning. We are really honored to have great guests to give us an update on some work happening at the legislature. So I want to just quickly go over our agenda for the morning. Obviously today the goal is to hear about the work that the legislature does, both from an advocacy perspective and from distinguished elected officials, about the work that they do to influence policy where we live, work, learn, and play. We'll get critical updates on affordable housing and behavioral health, and we'll also be getting an update on recently passed immunization law, obviously a very timely topic for everyone working in public health. And we will conclude the event with the first sneak peek at CPHA's policy priority survey results and top issues for our 2022 platform. During the fall town hall, please note that if you have a question for the presenters, you can use the icon that shows Q&A. If you have general comments for all participants or any tech challenges, use the icon that shows chat. So let's get started. I am first happy to introduce Diana Protopapa, if we can advance the slide. Diana is a partner of Frontline Public Affairs, and she's worked in public policy since 2000. She's been a contract lobbyist for CPHA for many years, and we're fortunate for her leadership. She's an accomplished lobbyist and political strategist, and previously worked for the Colorado Medical Society. Diana is going to be helping facilitate our conversation with our state representatives this morning. Next slide. And our distinguished first guest. So born in Detroit and having lost his father as an infant, Representative Stephen Woodrow learned from an early age the importance of family and having a strong safety net. A Colorado resident since 2011, Rep. Woodrow is working to make Colorado a more just and equitable state for people of all backgrounds. He is a firm believer in the American dream, the idea that if you work hard and play by the rules, you ought to be able to do better than your parents did. This starts with ensuring affordable housing, access to quality education and healthcare, and protecting our land, air, and water. Rep. Woodrow is a member of the Affordable Housing Transformational Task Force, and he will be providing updates on the committee's work and expectations for the upcoming session, which kicks off in January. Representative Woodrow, we're so fortunate to have you, and I'm going to turn things over to you.
Thank you so much, Ellen. Thank you, Allie. Everyone online, it's so exciting to see everyone. I really appreciate you making time on a Thursday to hear about the work we're doing down at the Capitol on affordable housing this session. Just a couple other things. It's really nice to see my colleague, Rep. Michelson-Janae as well. I didn't know she was going to be on this panel, and that just makes me really excited. So thank you, Daphne. It's good to see you. I serve on the Affordable Housing Transformational Task Force. This was created when we had ARPA money coming into the state. Our Democratic caucus in the House got together and we said, how are we going to best spend almost $900 to $1 billion of your money to really address some pressing needs here in Colorado? And we had a very official conversation and voting process that involved colored Post-it notes that we stuck on the wall. And I was really excited to see that the two issues that really sort of rose to the top and came to the forefront were affordable housing and behavioral and mental health services. Obviously, these are one-time dollars. We want to make sure that we maximize our ROI and get this right. And to know that the caucus as a whole decided that this is what we wanted to prioritize, it was really exciting and encouraging for me, especially as many of you probably know. I work very closely on affordable housing issues in my private life. I am an attorney. I represent tenants oftentimes in large lawsuits against powerful landlords. And I can tell you that affordable housing, and you probably already know this, has become a real challenge here in Colorado. At the same time, we have a mental health crisis that has only been made worse through the COVID-19 pandemic. And when I think about these two issues, affordable housing and mental health, I really think that they go hand in hand. You can't just go up to someone who's homeless living on the street and say, what's got you down? There has to be a baseline level of support. And I think that that all starts with housing. At the same time, you can't take someone who's in the midst of a mental health crisis and just stick them in an apartment and say, good luck, see you later. We know that the model that works best to address our affordable housing needs and our homeless crisis really comes down to affordable housing with wraparound mental health services. So the fact that the caucus prioritized these two issues together as the best way to spend these dollars is just really encouraging, and it's an exciting opportunity, and we want to make sure we get this right. So the Affordable Housing Task Force is comprised of several legislators and members of the administration and community members, all who are deeply invested and care an awful lot about affordable housing in Colorado. We are hearing from a subpanel that is comprised of industry folks and experts who work in this space. They come to us with their recommendations, and we listen and we try to process the information. And our goal is to issue a report and recommendations as to what the next best steps are. This is an issue that has been studied extensively in Colorado. And so what we're really looking forward to are solutions as to, okay, how are we going to deploy these dollars and get our best bang for our buck? The task force has told the subpanel that we want them to look at four main pillars in terms of affordable housing: capacity, stabilizing our existing supply of affordable housing, strengthening the safety net, and equity and access. And all of these pillars, when we are looking at the different solutions that are being offered up from the subpanel and otherwise, we sort of grade each of the recommendations being made, through these lens. How will the proposed solutions impact capacity? How are they going to help us stabilize our existing supply of mandated affordable housing and our what's known as naturally occurring affordable housing, things like mobile home parks, modular homes. How is the proposal being brought forward going to help strengthen the safety net? And then, are these solutions being brought forward with an eye towards equity and access? Are we helping the most disadvantaged communities, our BIPOC communities? Are we focusing our attention on groups that have historically been shut out of the conversation? And so that's sort of what we're looking at. I see a question came in on capacity. So ever since the crash in 2008, Colorado has done a really lackluster job in keeping up with our stock of affordable housing. We don't bring enough new units online every year in order to meet the demand for affordable housing. We have an influx of folks coming to Colorado from other states, and that's great. We're an attractive place to live. I love living here. I assume many of you do as well. We're pretty lucky and privileged to live here, and other people want to share in that experience. And so when we talk about capacity, we're talking about the number of affordable units that we have available at different bands of AMI. Whereas in the past, there were, always below 100%, but at least some amount of supply out there. If you're at 80% AMI, if you're at 60% AMI, there were some options out there for you to try to acquire affordable housing. Today, we're behind on our development by about 40%. That's what Director Allison George from DOH has basically been drumming on, is that we have not kept pace in terms of bringing new units online. Though new units that we do happen to bring online are often luxury units. That's because developers, in order to get a return on their investment, need to turn those units into luxury rentals as opposed to affordable units to make the numbers work for them. And so it's been a real challenge, when we're talking about different solutions. What can we do to develop new units that we can maintain affordability, not just in the near term, but over the long haul? So how do we bring the most number of affordable units online for as long as humanly possible? And that includes stabilizing our existing supply of affordable housing. So when, mobile home parks are now sort of the focus of many outside investment groups, private equity funds, hedge funds are looking at modular home parks, mobile home parks as an investment opportunity. And oftentimes what they'll do is they'll come in and make an attractive offer to the owners to sell. They make nominal or modest repairs, and then they jack up the rental price, and it prices the current residents out. And so last session, with the help of Representative Hooten, we did a good job passing a bill that provides a right of first refusal under statute to the community owners to allow them to come together, pool their resources, and get financing to actually purchase those parks so they don't become unaffordable. And so far what we've seen is sort of mixed success. I think there's something like 2 out of 50 some odd sales that have occurred where the residents were able to come together. What we're finding is that they don't have the ability to access capital as quickly as they need in order to exercise those options. And so when we're looking at, not only at addressing this problem, we're looking at not only bringing new units online through encouraging development and the sustainability of affordability as long as possible, we're looking at maintaining that existing supply so that when covenants come up, when sales are about to occur, we can come in and provide the necessary capital to keep the communities affordable. So with those 4 pillars in mind, we've been hearing from the subpanel and our experts. There's a question that came in: what's the definition of affordable? We're basically looking at it across the spectrum. There's a band, basically 30% AMI and below, and that's one level of affordability that we need to address. There's a band that goes really from about 60 to 140% AMI. That's known as the missing middle or affordable workforce housing. But that whole band essentially, from the poorest of the poor to people who make over the average, the area median income, all of that needs to be addressed in terms of affordability. We have a lot of folks who work but can't afford to live anywhere near the place where they're employed. And so that increases our transportation costs, that contributes to climate change. We've got to get back to having people be able to work and live in close proximity. And so that's a challenge that the task force is addressing. On the broader scale, when we look at affordability, we generally use a benchmark of 30% of your average monthly income. That's something that the federal government, that's a benchmark that they've used since about the 1980s. It used to be 25%, but then I got bumped up in the 80s to about 30% of your average monthly income. Anything above that, when you're spending above 30% of your monthly income on housing, you are referred to as housing burden. And so what we're really looking to do is bring prices down to a point where they're at about 30% for these different income bands. But we've been hearing from our subpanel and the experts, and I want to talk real briefly about what the Affordable Housing Transformational Task Force is sort of supposed to do. We want to use these one-time dollars to be as transformational as possible. But we need to do that within the context of the money we have, recognizing that it's not an endless supply, and two, sort of the existing structures that are in place. We also, when we hear from the subpanel, the stuff that sort of floats its way up to us has to meet a pretty high threshold in order to get there. For the subpanel to make a recommendation to the task force, it has to get 70% approval from the subpanel. And so, when I go in and I talk about sort of the subpanel recommendations that we're currently focused on, note that it's not an exclusive list of everything that the subpanel has considered. There are ideas that the subpanel considered that might have received a majority vote, but did not get up all the way to 70%. And then there's also ideas that have come from folks like you, from the public, that the subpanel hasn't really sunk its teeth into yet. And so what we've done is we've listened to the subpanel's recommendations that received 70%, that met the 70% threshold or higher for being recommended to us. But we've also asked them to go back and take a really hard look at some other recommendations, some other concepts. And I'm going to talk about both. I'll start with what we've heard from the subpanel and the ideas that have sort of made their way to us. First, revolving loan funds for new and expanding new and existing capacity. Loan funds are great. CHAF is very excited, and other groups are very excited about the ability to deploy capital to get these projects started with very low, below market interest rates. And so that's obviously something that is exciting to us. There's the idea of expanding our current system of tax credits. We have an idea for nonprofit and local government grants. Loans are great, grants are better in terms of allowing people to, really use the money and not have to worry so much about paying it back. At the same time, if we're looking at leveraging these funds over and over, the revolving loan funds are a great way to do that. There's a focus on resident-owned communities and mobile home parks and land banking. There are proposals being put forward for rental assistance, mortgage assistance, and down payment assistance. And then there's also a fund that they're looking at for housing innovation, which has sort of been described as the junk drawer in your house. Everyone has a drawer in their house that's stuffed with all sorts of odds and ends, and you don't think it's all that important, but how many of us could actually run our households without the tape, the coupons, the pens, the pencils, the rubber bands, etc. All of these ideas from the subpanel are good, and most of them, after thorough debate, like last Wednesday, we met for 9 hours, and we had a lot of discussion about these different ideas. Most of them received favorable support, but again, these are the ideas that received 70% or more approval from the subpanel and the experts themselves. And so, we do have to ask ourselves, what are the ideas that didn't necessarily trickle their way up? And so, we're looking at things like short-term rental rules. There's a lot of communities like mountain resorts that have been hit particularly hard due to their STRs, that short-term rentals. We have outside investors coming in and purchasing up, the single family homes or the duplexes that are currently in these mountain communities, which are, due to their geographic nature, sort of limited in terms of space where you can build new development. And so when you have these investors coming in and turning these properties into short-term rentals, that's really good for the investor, but it's really hard for the community. And what we're seeing is that it's pricing out employees who would love to work in these mountain resort communities, who would love to be the ski instructors and the people who work at the restaurants on the mountain, but they can't afford to actually live there. And so it's definitely impacting supply. And we are taking we want to take a hard look at those rules as well. Who comprises the subpanel? I'll pull up a list in a little bit and I'll type my answer into that one. It is a fairly diverse group, of experts and community activists. It also includes the apartment association. So you have a bunch of competing voices on the subpanel, sort of, sometimes working at odds with each other, but all of them, trying to come up with the best solutions on how to spend the money. And I will applaud their work. They have met numerous times. They take it very seriously. And, I don't think the task force itself could really do the job that we're doing without their input and all the hard work that they're putting into it. Overlaying all of this, of course, is the governor's office and the governor's budget, which was released earlier this week. And the governor's team has certain specific ideas as to where they'd like to see this money go. The governor's budget includes $100 million in grants to build new infrastructure and infrastructure support for affordable housing. So one thing that we hear from local governments and communities when they try to build affordable housing is that there's insufficient transportation, there's insufficient water access and power and electricity access. And what they need is the state's assistance to come in and make sure that there's transportation, make sure that we can get water to these communities and power, clean, affordable power. Speaking of that, the governor is proposing $25 million for green energy improvements. One of the things that is being brought up is that we are transitioning away greatly from a natural gas grid and an oil and gas infrastructure when it comes to our energy supply and onto greener technologies like electricity and electrical appliances. As we make that transition, the people who are going to jump off the sort of natural gas grid first are going to be wealthier communities who can afford these new appliances. There's a lot of discussion about making sure that when we increase our new affordable housing stock, that we're building the materials in a way that's sustainable and that we're outfitting them with these newer technologies. As wealthier residents get off the grid, the fixed costs of maintaining that system are going to fall disproportionately on the least fortunate among us, right? And that sort of, presents strong headwinds or it counterbalances the affordability piece. If we build something that someone can afford the rent on, but can't afford, 10 years down the road, the utility costs, we haven't really done our jobs. So the governor's office is aware of that and has proposed $25 million for green energy improvements. The governor's also requesting $25 million for housing innovation. These are things like modular home projects, tiny homes. I'm sure many of you are aware that homes can be 3D printed now. We are looking at these sort of smaller models on modular homes and housing innovation. There's a company that actually makes homes out of shipping containers. So we're taking a look at all of these sort of new innovations, and the governor has requested $25 million to be set aside, focused specifically on that. The governor's also finally requested $25 million to address that missing middle that I was talking about. So the Colorado Housing Finance Authority, CHFA, has a middle income housing assistance program. This is specifically to leverage the funds that we do have with local government dollars, philanthropic dollars, to sort of pull those resources together and see what we can do to build workforce housing. Employers have a vested interest in making sure that their employees can come to work. And part of that means shortening the distance, like I said before, making sure that employees can live close to the workplace. Otherwise, you end up with employees calling in saying that they can't make it, the roads aren't clear, et cetera. So that's the governor's priorities. For the most part, they dovetail fairly well with what the subpanel is recommending to us. But all of these solutions are basically coming to the task force, and we're vetting them. We're asking questions. We're trying to figure out how to best allocate these funds, among the options that we're being presented with. At the same time, I mentioned the short-term rentals. There are a couple other items that the subpanel hasn't really touched upon that I personally have asked them to go back and look at and vet, and then come to us and tell us why it's a good idea or a bad idea. One big area is TIF financing, tax increment financing. When you talk to developers, when you talk to people who sort of finance these deals to get new developments built, you learn a few things. One is there is an infrastructure problem. Water fees, tap fees, state, local taxes present a real obstacle sometimes. How high they can go, the parking restrictions, all of these things we need to take a hard look at and figure out what incentives can we offer to developers to get them to essentially covenant to keep a certain percentage of the rentals that they're building affordable, and to maintain that affordability over the long term, allowing them to go a little bit higher, relaxing the parking restrictions, waiving some of those state and local taxes for a certain number of years. All of those incentives can be used and deployed to encourage developers to build more affordable housing. Another real issue that we have in Colorado is a shortage of condominiums. I'm an attorney in my private life. Like I said before, most people would blame me and my colleagues for the reason why we don't have condos, saying that it's prohibitively expensive. The insurance that you have to get for the liability is too steep. So we really need to take a look at that and talk with one another and say, are the rules that we have presently in place too cost prohibitive? Other states have addressed their affordability problems and ownership problems largely through condominiums, and we really need to take a hard look and understand why in Colorado it's been so different. Another thing that I've asked the subpanel to take a look at, which kind of elicited gasps among the room, was a public bank. This would obviously be a tremendously heavy political lift and a big political fight. But a public bank is essentially an entity. It's a bank run by the state that would have the ability to loan out 10 times its reserves. So if we're talking about opportunities to leverage these funds, even a $50 million investment into a public bank would result in approximately $500 million that we could use to do a lot of the things that the subpanel is recommending. Things like revolving loan funds and grants to local governments. A public bank could easily create revolving loan funds within its portfolio and offer interest rates well below market, waive fees, etc. Some of the more conservative voices on the task force get pretty scared at an idea like that. They hear public anything and they hear socialism. But I do think that it is something that the subpanel should at least vet and discuss and debate and then let us know their thoughts, even if it doesn't necessarily meet the 70% threshold. So in a nutshell, that's the work that's going on at the Affordable Housing Task Force. I'm taking a look at some of the questions that we're looking at. So what specific policies are on the table to address this? Housing subsidies, new taxes, beyond using federal money this one time. So that's a broader question. The task force is really sort of tasked with how do we spend this federal money? But I do think that part of the report and recommendations are going to touch on on, sort of these other issues. What type of subsidies, in terms of taxes, that's not something that we've really hit too hard on. But what we are doing is we're looking at things like, from the non-money side, we're looking at the policy side, right? When we talk to local governments, when we talk to people in this space, they say a big issue that we're coming up against in Colorado especially, and districts like mine. I'm from House District 6 in Denver. That's some of the more traditional communities like East Wash Park, Hilltop, Bonnie Bray, Belcaro. We're taking a look at single family zoning. When you have zoning restrictions in place that limit the housing supply, it's going to cause an increase in price and make things less affordable. So it's not just the money piece that we're talking about. We are looking at the policy side, although the overall sort of mission statement of the Affordable Housing Transformational Task Force is to really look at the deployment of these one-time dollars. I believe.
So Representative Woodrow, sorry to interrupt. We have to move on to Representative Michelson-Janae, but I think we have some interest from folks in the deadlines of when decisions will be made from the task force. And then how can public health help influence the process? I think there's interest in the one-time money, but you've mentioned this is such a complex issue to kind of untangle and to try to repair. Are there other opportunities that you envision in the next 6 months in the session or beyond where public health can elevate our interest and knowledge in this issue?
Sure. So the most important thing you can do is let your voices and opinion be heard. The next opportunity to do that is at our next meeting, November 10th. That's next Wednesday. I'm happy to get you the details, Ellen, on when folks can show up. But we'd love to hear from the community and your ideas. A lot of these things being mentioned in the chat are spot on. We have to pair these dollars with the behavioral health dollars, and the subpanels are talking with each other on that. And so that's fantastic. I'm sorry, what was your second question?
Just beyond the task force, are there going to be opportunities for people to influence just the policy conversation around housing and affordability moving forward as well?
Yes, absolutely. So this session, there's sort of mixed feelings about how much we're going to be able to get done. I wasn't allowed to vote. If I was allowed to vote, my song would have been "Hit Me With Your Best Shot." I think that we have a trifecta right now. We don't know how long that lasts. History tells us it's certainly not permanent. We have to get done as much as possible while we have the numbers and while we have the majorities. And so I welcome your input. Rep Stephen Woodrow, Stephen with a V at gmail.com, Rep Stephen Woodrow at gmail.com. You can email me with your ideas and talk to me literally at any time. I don't sleep anymore. So, we can discuss these issues and really anything else on your mind. But that's what this session is going to be about. It's going to be about you all coming together with your priorities and letting us as legislators know what you want to get done.
Awesome. We really value your time and appreciate your leadership in this issue. And thank you so much. And for those questions we did not get to answer, we will try to respond to those in our upcoming Public Policy Committee, which meets monthly on the first Thursday of the month. And we know, Rep. Woodrow, you need to move on with your day. So thank you again for your time. We greatly value your support and attendance today.
Great.
And
thanks
now
so much.
we will turn it over to Representative Daphna Michelson-Janae. Daphna Michelson-Janae is the president and co-founder of the Journey Institute. It was founded after her 2009 journey to all 50 states in 1 year. She continues the mission of community building and problem solving. Her book, It Takes a Little Crazy to Make a Difference, won the 2015 International Book Award in the social change category. And she has a marquee event with TEDx Cherry Creek Women. Rep. Michelson-Janae is in her 11th year curating TEDx events in Denver, and she currently represents Colorado's House District 30, which stretches from northern Aurora to rural Adams County east of DIA and back into parts of Thornton and Commerce City, where she resides. This is her third term as Colorado State Representative, and her legislative work really focuses on youth, particularly mental health, as well as healthcare access. And she currently serves on the Behavioral Health Transformation Task Force, which we will hear about today. We're so honored to have you join us, Rep. Michelson-Janae. Thank you so much.
Thank you for having me, Ellen and crew. My first question to you will be, is the noise where I'm sitting too much, or can you actually hear me?
We can hear you.
Okay, great. Because I have the plan B is to go outside, a little less echoey. So thank you, everybody. I am coming to you direct from Tampa, Florida, and the National Conference of State Legislatures. And I caught the tail end of what Rep. Woodrow was sharing with you, and I'm going to give you kind of the bird's eye view of the Behavioral Healthcare Transformational Task Force. And what we've been tasked to do, and this, the creation of our task force and our mechanism for operating came out of Senate Bill 137, which was my bill in the House. I carried it in the House. It started with Rep. Pedersen in the, Senator Pedersen in the Senate. And ultimately, we are tasked to come up with some sort of transformational impact to the behavioral health care system. And while that all sounds, groovy, it turns out that there is a lot to the behavioral health care system. And so we are trying to figure out how we can make the greatest impact with the money that we've been given, or we haven't really been given the money. We've been told we have approximately $450 million. And what does that look like? We've been hearing from different segments of the community, including the department and the governor's requests over the last several months. We are organized in a task force with a subpanel with working groups, which means that there are about 4 hours of meetings, 4 days a week going on right now. And we are really trying to dig deep into the different pillars of the behavioral health care system, starting with accountability. We're looking at all of the areas where we have gaps in coverage and care. We have a youth and family track. So ultimately trying to hear from as many people as possible what's going on. The challenge with that is we have learned, and this was a surprise to nobody, that this is a very major challenge. Unfortunately, Mental Health America's rankings of the cities for mental health just came out last week, I believe. And what we found was that mental health care for adults is worse in Colorado than in any other state in the nation. Dead last. And that's a really distressing place to be. When you think about what's going on in the world and what's going on in different parts of our country, for Colorado to be dead last on that list for mental health care of adults, we have a lot of work to do. This ranking is based on access to care, based on suicidality risk, based on people taking up mental health wellness, and we are just dead last. The good news was the youth were no longer ranked last. We were in the bottom 2 or 3 for the youth for a long time. And we have popped up to 39th. So a significant climb, which says that the things that we are all doing together as a community to increase mental health of our youth is getting us somewhere. And yet at the same time, we know that we're in an incredible crisis with our youth. Children's Hospital Colorado, at the end of our legislative session, declared a mental health state of emergency for our youth. And what we found just a month ago was the National Children's Hospital Association declared that we are having a national pediatric mental health state of emergency. So Marcy asks the source for the ranking, and that's from Mental Health America's 2022 rankings. So 2022. I'll try to find that that link here in a little bit, but it's from Mental Health America. So as we look at all of these things and we try to figure out what's going on in our own community, part of what I feel is my job as a legislator is to figure out strategically how we can make the greatest impact with the money that we have. And as we all know, $450 million is not a panacea. It is a lot of money in Colorado. It's more money than we usually have to put into a program. But how do we make that money stretch as far as humanly possible? So the governor's proposals all came with recommendations where the money could be matched or increased by state and local, or excuse me, county and local dollars, which is a great strategy. But one of the other strategies we're looking at is, what if we identified an area and invested a fair amount of money into that area? Could we make a transformational impact? And that's our driving goal, is to create transformational impact. So what I'm going to share with you right now is, you're going to get my bias. This doesn't mean that this is where we're going to go, because we have not made any sort of final determinations. So I want to be very clear. What you are about to hear is my bias. Anybody have any question about that? No? Okay, here we go. So when trying to make a transformational impact, to me, it seems to make the most sense that we invest in our largest behavioral healthcare provider in the state, which is, of course, our criminal justice system. If we look at how things are handled from youth to adults with mental illness, we are putting people in jail for the supposed crime of being mentally ill. Now, are we, pulling people off the streets and saying, you're mentally ill, you in jail? Yeah, actually, we are. That's called our homeless population. And that's not all of our homeless population, but that does happen to members of our homeless community. But if we look at our criminal justice system, right now we have 350 people awaiting competency hearings. 350 people. And this is a rolling number. So we might get some who are cared for, and then some who are moved on, and that number continues to stay around 350, but it fluctuates up. It doesn't generally fluctuate down. Well, the governor had in their proposal a 14-bed facility to be able to help that population, to which I said 14 beds for 350 people? Question mark, exclamation point, and all sorts of other shapes and symbols. And the challenge is, as the administration looks at it, they're looking at how do we more broadly spread the money. And I'm saying, how can we more targeted spend the money? So let's say we wanted to get those 350 people who, by the way, we're paying court fees over and all sorts of other fines because we're violating their civil rights. So let's say we invest in getting the 350 people out of the correctional department and into a behavioral health treatment facility. And what that treatment facility looks like, we're going to just right now just put on the table, assume it's the right kind of facility, right? Let's just make that assumption while we're talking together. So we can move 350 people out of the criminal justice system who are costing us an incredible amount of money to keep in jail, who are waiting for competency hearings, who are costing us money in our prison system, who are making us need more beds in our prison system, when really what we need are more beds in our behavioral health system. So if we move them to the behavioral health system and take the money with them that's being spent in the criminal justice system, don't we start using our money more responsibly? And as we look at the more global situation that, challenges that we're trying to solve, many of you know that my personal passion is youth mental health. And I am the mother of a young man who attempted suicide at 9 years old. So that's fourth grade at school, and learned firsthand through my son's experience and through my own volunteer experience in juvenile correctional facilities that, similarly to adults, we have kids who are in our correction system who probably actually need residential treatment of a mental health perspective. And even if it's not residential treatment, it could be group home treatment, it could be foster placement in medically appropriate homes, but the criminal justice system is where we're putting them. I remember going through the experience with my son and volunteering at the same time, like all of this was happening at the same time. And one day I said to my friend, yes, I'm looking at colleges for my daughter and prisons for my son. And when the words came out of my mouth, it was shocking and alarming, and also exactly what I was doing, because I knew that my son was on the school to prison pipeline train. He's on that school bus. That bus was going. The police were called on him multiple times in elementary school because of his autism spectrum disorder, and the school not understanding how to handle autism spectrum disorder. So we're looking at a whole number of things in terms of how do we look at our kids today, both our kids who are currently incarcerated and need to be in mental health programming as opposed to incarceration. Doesn't mean that they didn't commit a crime. And I recognize that. We were talking about schizoaffective disorder and bipolar disorder and things that really need strong management, and when they go awry can cause physical harm or damage to people in the community. I'm not saying that that's not a thing. What I am saying is we're never going to get them ready for society in our criminal justice system. And so for those people who we think there's a mental illness that needs to be addressed, this is that opportunity to take them out of the criminal justice system, put them into an appropriate behavioral health facility, program, house, foster home, whatever works and is most appropriate, right? We need to go to the least secure level of care. That's what our Constitution says. That's what our dollars from Medicaid say. There are all sorts of rules that we have to follow that we're not following because we don't have the facilities for kids with mental health disorders. So if you're thinking, well, Daphne, there are more kids with mental health disorders than are in the criminal justice system, holla, because absolutely. And right now we don't have the facilities to give them a range of care. All we have is we have the option from, are you able to manage with support from your school counselor and stay in school and class and function? Or do you need hospitalization or partial hospitalization? Where's everything in between? Because we can actually help kids well before they get to partial hospitalization or hospitalization. We really can. I mean, scientifically proven, you guys know. So we're looking at what would it look like if we created a facility, say on Fort Logan's campus. This again, you are hearing what Daphna's mind wants to see happen with the $450 million, okay? And we are able to build a facility for kids who cannot stay within their public school system. And we have options. This can be a day program. This can be a boarding school program. This can even be a secure facility program if we're taking some of the kids who are incarcerated who still need to be in a secure facility for some reason or another. We could have that possibility as well. So while we're both addressing the needs of our youth that are incarcerated for being mentally ill, we are also handling the need from the community, from youth who cannot exist in our general public schools. And here's the thing, it's gonna be free. Okay, what does free mean? Free doesn't mean anything because there's always a cost. When my son was ready for high school, I could not find a single school in Colorado where I thought he would be safe. When you attempt suicide when you're 9, you mostly just try to hurt yourself. When you attempt suicide when you're in high school, that looks far different. And we know it. And we've experienced it firsthand. And I didn't feel that there was a school in Colorado where he could be both given help for his mental health concerns, for his autism spectrum disorder, and, you know, lowest on the list of things that I cared about was his education, but I did want him to get an education. So we ended up sending him to a boarding school that cost $50,000 a year. Wow, I make $40,000 a year. The math just doesn't work. So what if this school was a public school that was partially paid for by Medicaid and insurance coverage for the medical components and medical elements and therapeutic elements of the program, and per pupil funding for the education components of the program? There is a way to do this. And we could tackle both our population of our youth who are incarcerated and our population of youth who are struggling in our schools and are not yet incarcerated, because they don't need to be incarcerated. I also want to throw one more thing out there, which is a little bit off the mark, but something I would love for you all to consider. In my non-political life, I am a curator of TEDx. So TEDx Cherry Creek is our event. And we have an event coming up in December where we have a physician who is working on a concept that ACEs, right? The ACEs study has a major flaw in that it doesn't consider trauma that happened to a child at school. All of the questions are home-based. Well, I can tell you her experience and my son's experience. My son's trauma was at school, not at home. And we have to look at that full spectrum when we're trying to take care of our kids. So how do we recognize that there is a need? And we know that there are gaps in the continuum of care. But if we focus our money on the criminal justice system as the starting point, we will be building all of the facilities we need to care for the entire continuum of care. Now, is that going to be what comes out of Behavioral Health Transformational Task Force? If I'm good enough at my job, it will be. But there will be other things as well, including medicated assisted treatment in jails, which is very important to us. And we are also working on the homelessness and behavioral health juncture. So not everybody who is homeless has a behavioral health disorder, but many people are. And we are looking at concepts starting with medical shelters, if you will, that would be places for people who are experiencing both mental health or other medically complex needs and homelessness, so that we could start by getting you healthy and ready to take care of the world, of yourself, and then enter the world. So that's a little bit of what's going on the Behavioral Health Transformation Task Force. And I was not able to keep up with the chat. So if there are any questions, I'm happy to answer.
Thank you so much. Well, the chat is very complimentary, and I think getting a lot of acknowledgement that what you're saying is really jiving with what people are experiencing and perhaps their personal life and professionally. So thank you so much for your comments. I know that Diana, who lobbies for CPHA, would like to give just a quick update on kind of the Transformational Task Force timelines, and then maybe we can get into a question or two. I know you need to get back to your conference. So Diana, to you.
Sorry, I always do that. Thank you, Representative Michelson. Janae, you are awesome. I've never seen somebody speak so seriously and still make me laugh. So thanks for that. But now that you're still here, do you want to just spend 30 seconds talking about what your charge is, whether you're going to be, running bills in January, whether you're going to be giving a report, when the report is due, et cetera?
Yeah. So what's supposed to come out of our committee is a report that will guide our legislation and spending. So we don't have specific bills that will come out of this task force. What we will have is a report on recommendations on where to spend. And again, as we work together as a task force, I'm hoping that we can help narrow that focus so that we can get to some really transformational change. We are supposed to go through a voting exercise regarding some of these recommendations that are going into the report next week. I anticipate that we'll have a report sometime after Thanksgiving, and doesn't give us a lot of time before session because Christmas and New Year's, but it will help us at least have the base report for us to work off throughout the session.
Thank you.
Representative, can you stick around for maybe a question or two?
Yeah.
We have a question in the chat about how the task force may be addressing prevention dollars. Are there any, and I know across children to adults, that's probably a big question, but if there are a couple you want to pull out in terms of considerations you're giving to that.
Yes, that's really an excellent question. Prevention is something I care about greatly. I passed, it took me a couple of years, annual mental health wellness exams as a essential health benefit in Colorado. And we are working as hard as possible to help get people to understand that maintaining their mental health is the best pathway to not having serious mental illness that goes unchecked or untreated or becomes overdeveloped because you haven't been able to take care of it in advance. As far as with the ARPA dollars, I know that we have been speaking about prevention, but I don't have a specific project or program that we have been looking at.
Thank you. Maybe one more question on just, it sounds like folks are very interested in increasing access to providers. Is there a conversation around workforce and increasing access through greater people, human capacity?
Workforce. Yes. So we've been trying to be as focused, evidence-based, and creative. Those are all hard things as possible. And one of the things that we've seen post-COVID is a 30% departure from the behavioral healthcare workforce. So how do we reach out to those people who have left the workforce and recruit them back? Is it that they need to have support in getting a higher level of licensure? Is it that they need they want to go a different way in the behavioral health space? Is it that they want to be in the medical field but not in the behavioral health care space? So one thing is kind of considering how do we recruit back the people who have left the workforce? Number two, and part of that includes recognizing that there needs to be respite, sabbatical, et cetera, for our healthcare workers, especially post-COVID. I mean, we see how critical that is. Second, how do we work on recruiting the team we need? My firm belief is that the entire workforce that we need is here in Colorado, but we have to go recruit them. I give the example all the time that if I want people who are diverse on my TEDx stage, I have to recruit them. Otherwise, I will only get applications from white people. That's it. The same might be true with the fact that, I understand that we're giving away all of the money that we have every single year to help cover education costs. But if we're not going out and recruiting the specific people we need, we're going to just perpetuate having a workforce that is not diverse, that does not fill the needs of the community. So I'm asking us to think about it like recruiting a football team. Can we hire a recruiter? Oh, and a football team that actually wins? Because anyway, so what if we hire a recruiter or a recruitment team to go out and start working, for example, by recruiting our CNAs to become psychiatric nurses, which wouldn't be that difficult of a stretch for them. They've gone through CNA training, they've maybe worked in the CNA arena for 10, 15 years. This could be an appropriate time for them to up their training to psychiatric nurse. And what we have learned from people like Dr. Thurstone at Denver Health is that psychiatric nurses are kind of that front line, that if we have a full staff of psychiatric nurses, we can stretch the therapeutic staff, right? So how do we start thinking about our workforce in that way? So I'm hoping that we will be spending a lot more money paying to get people educated in the way they want to be educated, especially in our rural communities. And again, we're not waiting. We're going to knock on your door. Hi, you former teacher. How would you like to be a psychiatric nurse here in the community to help serve us? And we'll get that paid for you, and you get to work here in the community and stay with your home, et cetera, et cetera, et cetera.
Wonderful. I think we are at time. We need to shift over and learn more about immunizations, but thank you so much, Rep. Michelson-Janae, for your leadership. I think I speak for everyone on the call that we just appreciate your partnership, and CPHA looks forward to collaborating with you as the session kicks off here soon on behavioral health issues. And thank you so much for taking time away from the conference to give us an update. We really appreciate it.
Well, I
Take care.
appreciate all of you so much. And I just got my flu shot.
Yay!
So there you go.
Yay.
Bye.
Bye. Okay, we're going to turn now to Immunize Colorado. So as many of you may recall, the legislature met in 2020 for a very short summer session that was interrupted due to the COVID-19 pandemic. And I'm really pleased to introduce today Stephanie Wasserman, the Executive Director of Immunize Colorado, who's been in that position since 2012. She's also a big hero in the public health community and even won an award from CPHA many years ago for her outstanding leadership in public health. We're also joined today by Kaylee Stiles, who's the Communications Manager for Immunize Colorado, who also has experience working at the Colorado State Legislature. I'm going to turn the screen over to you all to give us an overview of Senate Bill 163, landmark legislation that Stephanie's organization led with a coalition of advocates to really improve kids' immunization rates in Colorado. Stephanie and Kaylee, take it away.
All right. Hi, everyone. I'm Kaylee. I'll be starting off the presentation today. So yeah, we're talking about the SB 2163, which was passed, yes, during the COVID, essentially what we called the COVID session in the Capitol, which went into effect for the 2021-22 school year. So if we can go to the next slide. A little bit of background on Immunize Colorado. We were founded in 1991 and formerly called the Colorado Children's Immunization Coalition. It's founded by a bunch of physicians, other healthcare providers, parents, legislators, and insurance providers to basically confront the problem of vaccination in Colorado with the knowledge that at that time, only 50% of school-age children had received routine vaccinations. And so we've been working on that in a variety of different ways: coalition building, community outreach, awareness, healthcare provider education, data translation, and then also actually helping partner with other healthcare providers to actually provide free and low cost immunizations. And most importantly, we accept funding from a variety of sources. None of those funding sources are vaccine manufacturers or distributors. Today, we're going to be focusing, so again, a little bit of background on all of those things that we focus on, but today we're focusing on public policy and specifically public policy as it relates to school-age children. That's kind of one of the not the only area of focus. We work for every Coloradan. We want every Coloradan to be updated on their vaccinations, but we focus on school-age children at the legislature at times because that's the most common point where children are needing to receive certain kinds of vaccines. Next slide. So a few things that we do know. We know that vaccines are effective. We know that they are safe, and we know that they save lives. Immunizations save approximately 33,000 lives. They prevent 14 million disease cases, and they save almost $10 billion in direct healthcare costs. We know that school-age children in particular, especially when children are entering childcare or entering kindergarten, that is an ideal, perfect safety net to make sure that everybody's getting vaccinated for everything at about the same time, and that all of these kids, when they start to gather in schools, in childcare facilities, that they are all vaccinated for the same thing and that they're all safe. And that really helps us access parents who are maybe not interacting with the healthcare system very often, or who may be hesitant. This gives them the incentive, the school age gives them the incentive that they need to get it done and have their children vaccinated. We also know that most Coloradans are vaccinated. Are vaccinating Sorry. Most Coloradans are vaccinating themselves and their children. Polling shows that 84% of Coloradans in all political backgrounds, conservative, liberal, left, right, they do support standard vaccinations. And then most excitingly, I do want to point out that the EUA approval for a COVID vaccine for children ages 5 to 11 was just approved by the CDC director on Tuesday. So that's 28 million more children that are able to access the COVID-19 vaccine. So very excited about that. Even all of these things considered, we still also know that Colorado is one of the lowest rates of kindergarten vaccinations in the country and one of the highest rates of personal belief exemptions, which is what 163 was meant to address. We were ranked last in the country for kindergarten measles and chickenpox vaccination rates in 2019, which puts a lot of kids at risk for these very contagious, very deadly diseases. During the pandemic, routine vaccinations for DTaP, varicella, and polio all declined around 70 to 80%. That's also very concerning and something that we're trying to address with the 2021-22 school year and try to get kids back up to date. We're also one of only 17 states that allow parents to exempt children for any sort of philosophical or non-medical reasons. And we previously had one of the easiest ways to claim one. Go forward. So this is just a quick map showing, over the last school year, what vaccination rates kind of look like countywide across the state. And you can see there's a lot more yellow, orange, and red than we would like there to be. And it's kind of spread all across the state. It's not very easy to draw like a geographical, lay over a geographical space and say, oh, it's the Eastern Plains, oh, it's the Western Slope, oh, it's the mountain range. It's all over the board, and it has a lot to do with various kinds of there are lots of reasons for that. Some of it's rural healthcare access, sometimes it's personal belief, sometimes it's just more of that access piece, but it's a lot of different things that we try to address with our public policy. Next. So Stephanie also wanted me to talk a little bit about the political climate and sort of what it looks like when you're at the Capitol, which I was during the 2020 and 2021 legislative sessions. This is a picture of one of the protests outside during an anti-vax protest outside the Capitol in Colorado. And you can sort of see from their signs that it's not just vaccinations. It's just, it's a kind of an array of different political beliefs that have all politicized vaccines as one of these sort of culture war aspects, I suppose. It's been folded into these culture wars on health that come along with pro-abortion, that come along with gun safety, that come along with climate change. And unfortunately, we do know that it's not most people, like I said before, it's not most people. It's a very, very noisy, we approximate like 5 to 6% of people who are that virulent kind of anti-vaxxer type who are protesting like this. And they're primarily there to harass, intimidate, create noise, and generally dissuade people from vaccinations. Next slide. And this is another protest outside of the safety net vaccination clinic. And again, people really, it's not just the Capitol, people go to these actual healthcare facilities, again, similar to abortion clinics, and they try to harass or try to intimidate people who are trying to access that kind of healthcare, especially with their children. There's more harassment when it comes to the legislators at the Capitol. Representative Kyle Mullica was the sort of the spearhead on SB 2163 and back in 2020, and he got death threats. His family was threatened, and it was because he was so physically and obviously very much at the forefront of what we were trying to do, and as a school nurse, it's exactly his profession to make sure that healthcare is accessible, that we're meeting these sort of healthcare requirements that 163 was meant to address. And the anti-vaxxers do have these sort of personal threats against people who come out in front and say, that it's a no-brainer, we should be vaccinating our children. And it gets very ugly. Next slide. Again, another protest, and you can see there's a lot of misinformation on these signs. The vaccines are made with aborted fetal cells, which was true of testing in the 70s and is no longer the case. That vaccines cause seizures, that there are risks. If there's a risk, there must be a mistake, and all sorts of things that are just absolutely not true. And then again, appropriating the language of abortion, my body, my choice, or things like that are just not relevant, not applicable to vaccines. And I will also say, having been in the Capitol, part of the intimidation factor is actually not just the fact that they're protesting, but the fact that they're in the Capitol, and they're individuals who are either unvaccinated or under-vaccinated, and they have children who may be unvaccinated or under-vaccinated at the Capitol. And that also is an additional intimidation factor that puts the health of the people who work there, the people who are there, people who are there every day, who have children at home, who might have grandparents that they see, puts them at risk as well, because no vaccine is 100%. And so that is part of the intimidation factor is just that they're in the building all day, and you have no idea what that might mean is floating around the building virus-wise, whether it's the flu, hopefully nothing ever as serious as measles or polio. But that is sort of a fear factor that they bring with them when they come to protest and they come to speak at the Capitol. Now I'll turn it over to Stephanie.
Thanks, Kaylee. I'm going to talk a little bit more about sort of the nuts and bolts of 163, what it did do, and the first year that it's been implemented. So the idea behind 163, which is the School Entry Immunization Act, was that it was based on this concept of equal effort. What we knew from the data was that it was really easy to claim a non-medical exemption in Colorado. And we wanted to put forth this idea that in Colorado, it shouldn't be easier to claim an exemption than it should be to get a vaccine. So we wanted there to be some parameters around how you claim a non-medical exemption, and reserve it for people with very strongly held beliefs. So the law actually was passed in 2020, and that last image was the rally that was held outside the hearing, the Capitol, the day the hearing occurred. And I don't know if you recognize one of the attendees at that rally was Robert F. Kennedy Jr., who's a very well-known, internationally recognized person, but he's the leader of the anti-vax movement here in the United States. The law was passed last session, the pandemic session, and it actually just went into effect relatively recently. So July 1st was the day the law went into effect. And what it did was several things. It consolidated the definitions of religious and personal belief into one term, which now is referred to as non-medical exemptions, and retained medical exemptions. So all states have the ability for parents to claim exemption from vaccines based on a medical reason. For example, if your child's undergoing chemotherapy, they could get a doctor to sign off on a form exempting them from school required vaccinations. But now we created this non-medical exemption category. It also standardized the forms. Prior to this, we did not have any standardized way that you could claim an exemption. For non-medical exemptions, you could literally write something on a napkin, a cocktail napkin, and turn it into your school. So now for the first time, there's standardized forms. And then it created this formal process, which did not exist before. So if you want a non-medical exemption for your child, you need to either get it signed, the official form signed by an immunizing medical provider, or you need to receive a certificate after completing an online education module. And then the other new component of the law is that all immunization and exemption data needs to be recorded in our consolidated state database, which is called the Colorado Immunization Information System. I'm sure many of you heard about it since the pandemic, since all our COVID vaccines are getting reported in there and being used very effectively to help identify whether someone needs a booster or their second dose series. So it's a really important database that the state operates. Next slide, please. This is just a quick view of what is available on the education module. It was developed by CDPHE staff that relied on expert content. It has evidence-based information on things like what is herd immunity, what are the diseases. And the idea is by taking this education module, a parent could get up-to-date information about the risks of disease versus the small vaccine safety concerns. Next slide. There were some other components in the law that actually have not yet been implemented. I think the pandemic has sort of put some of these things on hold, but hopefully one day we'll be able to implement these other components of the law, which are it established a 95% vaccination goal for school required vaccines. So any school that did not meet that 95% kind of herd immunity goal would be provided additional resources and supports from the state and from organizations like Immunize Colorado. It also requires annual notifications to parents of a school's measles, mumps, and rubella vaccination rate. Since this is the first year this was implemented, that data didn't get shared with parents yet, but next year there will be an opportunity for every parent to know what their measles rates is at their school, and hopefully advocate for higher rates if their kid is attending a school with very low rates. And finally, the law requires an annual review of an alignment between all the CDC recommended vaccines and the ones that are school required. So not every recommended vaccine is on what's called the school schedule. For example, the hepatitis A vaccine, which would be a great vaccine to be required in schools since kids can transmit it pretty easily between them. The idea is that every year there would be a stakeholder process where the state would review the new scientific evidence and any new recommendations, and then see if they should be added to the list of school required vaccines. Next slide, please. So here is just a snapshot of some of the early data that we have from the first year of implementation. So as of since July 1st, there were over 67,000 non-medical exemptions that have been filed using the new process. The truth, this is actually more than in previous years, but it's actually the first time that all this information has been required to be documented in our state database. So we don't have anything to compare this data with to see whether our non-medical exemption rates were lowered or raised through this new law, but the fact that we do have this consolidated data that's in one place is really important for further, public health actions if we want to do some more activity around trying to understand why there's so many non-medical exemptions claimed in Colorado, some outreach and education, and maybe some future policy actions. Most of these were created through the education module. So most parents elected to go through that online education module. A very small number of them, less than 1%, were achieved through the getting an immunizing provider to sign the form. And the different types of vaccines that people chose to exempt their children from were sort of spread evenly across the different antigens or the different types of vaccines. And this is the first year of compliance data in the database. So we're excited to have this data. We really need another year to better understand it. Next slide. This is just a quick snapshot of the things that Senate Bill 163 does not do. It does not require parents to vaccinate their children if they have a deeply held belief. It does not change what vaccines are required to enter licensed childcare facilities or schools. It does not punish parents who want to vaccinate their kids. who do not want to vaccinate their kids, and it does not make the information in the registry public. None of that information is ever public on individual patient level. There might be some data that's shared publicly that's been de-identified. In the end, it does really protect Colorado's kids. There are some other immunization policies that were passed prior to this bill that help sort of support the immunization policy framework. This is just a list of some of the other actions that our state legislature, along with our Board of Health. We can't forget how important our Board of Health is in passing immunization rules that help support healthy schools. Next slide, please. There are some toolkits available to help with the implementation of Senate Bill 163. CDPHE created a provider toolkit, and then Immunize Colorado, CDPHE, and the Colorado chapter of AAP also created a toolkit that was more parent focused and partner focused. And it provides some FAQs, how to review the non-medical exemption request, and also just the process. So those links here are available for people to access the toolkits. Next slide. I just wanted to add that Immunize Colorado really focuses a lot of attention on school immunization data. And we've created a school district data dashboard using the data from not from SIS, but from the school and child care database, which is annually reported to the CDPHE and made public. And then we create these fact sheets. This is an example of one based on all 160 or so school districts, basically highlights sort of what's being done well in each school district, where there might be additional need for supports and resources. And then finally, in advance of the legislative session, we've also created these legislative district fact sheets based on the immunization coverage rates in each of the Senate and House legislative districts. And those have been really helpful around advocacy to share with legislators and with constituents in each of those districts. Next slide. I think I've come to the end. We'd love to entertain questions if there is any time left. Thank you.
Thank you so much, Stephanie. We're really, pleased to hear about the implementation progress and look forward to continued lessons learned as the data comes in. And so future updates will be warmly received by this Public Policy Committee. So we don't really have time for questions, unfortunately. I think maybe just one quick question. Does the non-medical exemption form need to be completed annually for each child?
Great question. Yeah, so if you're for children, school-age children, kindergarten and up, that does need to be annually updated. And it expires, I think, June 30th each year. If your child is in childcare, a licensed childcare, it's more frequently, and the schedule aligns with how frequently you would be going to get a well child checkup. So between 0 and 5, it's, I believe, I don't know, 6 or 7 times that you would need to update that.
Perfect. And then we've dropped in the chat the toolkit, so please feel free to use those. I'm sure that will be very handy for many on this call. And there's a quick question about whether or not the toolkits or presentations are available in Spanish or any other languages.
Not at the moment, but that's a great request. And we have been hard at work translating a lot of our resources. So we'll put that on our to-do list.
Wonderful. Thank you so much, Stephanie and Kaylee, and thank you for your literally life-saving work that you do down at the Capitol and out in communities every day. We sincerely appreciate your partnership with CPHA. We are going to turn now to Allie to give a quick overview of our policy agenda for 2022. Allie.
Thanks for sticking with, sorry guys, it's really important that we're virtual today because I am a little sick. So thanks for sticking with us through the entire presentation. We're again so grateful for your interest and translate that into action for this coming legislative year. Annually, CPHA has sent out policy priority survey to only members. This current survey results that you're looking at include non-members because we wanted to include more diverse perspectives this year. So that was pretty exciting, and our participation rate quadrupled from the year prior. So we were really pleased about that. And about 40% of those responses were outside of CPHA. So just really grateful for that input. So these three top issues that you see on the slide, the first one is, first list is specific just to the public health workforce in Colorado. And next we have direct services top issues. And then last it's social determinants of health issues facing the communities that the respondents serve. So we were pretty excited to see some repeat topics that were also selected as priorities from last year. So those are the ones that are kind of highlighted in the tannish pink. And so the thing that we're really excited about is a little bit of change from last year. So if you look in the second section where it has the top issues facing communities we serve, direct service, immunization, vaccine preventable diseases popped up as one of the top 3 issues there. And it's been probably 2 or 3 years since that's been selected as a top priority. So I think COVID definitely shook the tree a lot to realize that we can't take that for granted, and we have to continue to be mindful on the policy side for vaccine preventable diseases. So I thought Stephanie and Callie would be super excited to see that as a priority for our platform in 2022. And because we're super short on time, I just wanted to let everybody know that these will be included in CPHA's policy platform for 2022, and it will be formally shared with the world in December. And if you have a big desire to help craft the final document of our policy platform, go ahead and send me an email, and we'll drop my email in the chat. And additionally, one last housekeeping item is we've had some questions in the Q&A about what we're going to do to follow up after this session, and we will have an email to all attendees that have every resource that's been dropped in the chat, and also information about the Housing Transformation Task Force meeting next week, and also contact information for the legislators and information about the TEDx event in December. And finally, the recording will be shared if you want to pass it on to any colleagues. So this is a snapshot of our policy platform, and we're excited to share the real deal in December with everybody. And we want you to join the policy committee if you have time. We meet monthly, and Ellen's going to tell us a little bit more about that.
Do you want to go to the next slide? So as we move forward with our day and into 2022, we just wanted to leave you all with this beautiful quote from Brian Stevenson, who founded the Equal Justice Initiative, which works to free people who have been wrongly incarcerated. And I think that the quote really speaks to our movement to act to get today. Public health begins when all of us recognize the humanity and dignity of every human being. We hope that in 2022, you will join us at the Public Policy Committee on the first Thursday of every month to take action together and really to recognize the humanity and dignity of every human being through the public policy decisions that we make on behalf of CPHA. Please email Allie. Her contact information is on the slide if you'd like to get more actively involved in the committee. And again, thank you so much for your time today. Your participation, your engagement has been wonderful, and we look forward to seeing you very soon. There is an evaluation that Allie is going to send out after this as well. I think it's also in the next slide. Maybe not. Oh, it's in the chat. If you want to fill out the evaluation now, that's wonderful. It'll also come through as follow-up. Again, thank you so much. Enjoy the rest of your day.